So my subject is like this, the art of regenerative medicine. I'm sure that most of you also already know that stem cell is the future, but the reason why I said treat patient with a blood stem cell in the easiest way is like that. This is my clinic I'd like to share with you in Cheongdam. In the meantime, if you could join to the front, it would be very nice. So I'm specialist in the laboratory medicine, and I'm a director of the Korea Stem Cell Society. And probably you guys all know the Gangnam style, so that's the Gangnam. But as I was told, this Park Hyatt area is like moved on to like Sukhumvit from the luxury area. It's also Cheongdam is where in Korea is the vibrant in terms of the luxury goods and all this stem cell things are going on. So the Lidiamang is my clinic in Cheongdam area. I basically focus in anti-aging on top of the stem cell. And on the side, I like the one that I showed today, the lip filler. So people do come with the lip fillers, under eyes, and the nasolabial marionette is what I focus as this aesthetic areas. Besides that, I mainly focus on the stem cell to actually cure the diseases that I'm going to share with you. So the stem cell is like a very fed. Indonesia, Vietnam, last month I was here with the APEM as well. So they are interested, the doctors are interested, and the patients are also interested about the stem cell treatment. Then how we should do about this thing? How do we meet those demands of a patient? I would like to put this disclaimer. What I'm going to share is based on in my clinic, based on the kit I'm sharing with you. I did not got any sponsor or any other financial things. So this is what I did, and it's simply the sharing my experiences. So it could be different to your Thailand patients as a come up result. So the simple things, the stem cells are growing. Why? Because the Bitcoin. Because people have too much money to spend. Now they can only to spend on the luxury goods after the stem cell. Could be, but I think probably the demographic reasons. People live longer now, and then they want to at the certain level. They just not just develop themselves. They want time to spend their rest of life with the other people or their family or their grandson. The reason why I'm saying this is I always say this to the consulting the CEOs. So it's not just about you, but the rest of the time you are successful. Okay, congratulations. But after that, with that all much of money, then if you cannot buy your health condition, it wouldn't be very happy times. It's not like a happily ever after stories. So emerging markets are toward this regenerative medicine. And regenerative medicine, on top of that, as I showed today, I'm trying to apply this on the aesthetic field area more. So I think we can broaden this in your clinic with the regenerative aesthetics as well. So stem cell therapy, the reason why we can continue on our facial or any other treatment like injection. I got questions from the lady, baby-looking doctor from the behind, and when we do the exosome or the Regeneron on our face, mostly about 200 shots injections there, and then when she or he's living, how can he or she can recover? That's simply because already inside we have these stem cells. So by somehow taking that and making more stem cell, putting back to your health, your body, that is very simple way about the stem cell treatment. Well, you all know probably what would be the best institution. I would say Harvard. So Harvard Institution, they also have this Harvard Stem Cell Institute. I was in 2005 as the internship thing for a month. They're doing so well, and if you go to the site, they're divided by disease cases. That is a little bit different that I showed you today, but that's because this is a university level, I'm sure they want to, their mission is to find cures for the human diseases. But the Novastem, or the fetish thing, the things I'm going to share is probably would more about like general condition, I would say, not like disease by disease. But what I do in my clinic is consulting, and then I try to discover this area as well. So I'm sure you guys all know that if we're talking about stem cell, there's embryonic, also adult stem cell. What we use, we just showed you, we're taking blood from the ewe. So obviously it's adult stem cell. So when we are talking about the Novastem or any other things that I'm going to share with you, is now we're excluding those ethnic issues. We're working with these adult stem cells. Three major sources what we do in my clinic also, and popular in Korea I would say, is bone marrow, also adipose tissue, which is fat tissue, which is abundant I would say, and what we just saw, peripheral blood, or just blood from your arm. The reason why we're doing the stem cell treatment, as we get older, the stem cell in our body itself decreases. Like think about it, I saw the cute babies there outside today too. When they fall over, they have a scar, the abrasion, he or she will cure in about 3 or 4 days. Think about your body condition a long time ago. I'm 45 this year now. If I flip over, if I get a bruise, it takes 10 days to recover. So which means I'm old. I have like less stem cell in my body as well. So many techniques has been evolved in area of the stem cell thing, adipose tissue, bone marrow, and peripheral blood. So this adipose tissue thing has a lot of cases, even the Western side as well. This is American one. They're all FDA approved, like taking SVF from the fat tissue to injection of the knee arthritis gets regenerative medicine. They're approved one. So when the FDA and Korea FDA, when they approve, they do not approve for the general condition uses, but they go for the diseases because that's the law thing as it is. So this is June 14th in Korea using fat tissue to the SBF in the knee area. So I directly translate to Thailand. So this is recent one. So this area, I would say, this is evolving, and then more and more cases are classified as the authentic treatment. The approved by KFDA means it is guaranteed that the quality or efficacy is guaranteed. That's what it means. And next year in Korea, they're opening these sessions for the more trial. They're allowing our doctors to do more trial, like in Malaysia. Malaysia, I have a mentor, Dr. Lan. He's super great doctor, and he's doing, not later if you look up the Dr. Lan, he's really, he did many trials also, and he has very good cases as well. So as I'd like to begin with the Novastem, but ultimately, I'd like to share and will do all this treatment for the future medicine thing. So, then why not just the fat tissue right away? Why not bone marrow right away? It takes time to learn liposuction. It takes time, and the maybe risky you have to take if you do own in the beginning to break that bone and put that thing stick in, taking bone marrow out. It takes time to learn that. As we see today, using the Novastem taking peripheral blood, it only took about 10 minutes, and until the making that 3 cc, even though I admit that it's not so much level, I mean the amount, but it was only taking 20 minutes to do our treatment. So I think that's very competitive about the peripheral blood kit thing. And I'm sure that you've been tried PRP one. So I was also got a question from the floor at the back. What is different the PRP in this kit? So I would like to definitely mention that as well. So we tried the hair loss, but also this is because the stem cell itself, we can treat anywhere, even though I said I admit that it's just a lower power compared to cultivated one. But about the hair loss and the like a local injection for the arthritis or the scar that I showed you on my arm, I think it helped my this elbow. So, and the hair growth as well. So rather than what you're using exosome, this is more powerful, way powerful than compared to the PRP long time ago or the exosome itself. How does it making the power? So when we take about 30 cc's, when you, as you saw today, there's about 80 million cells. This is proven from the company as well. There are only like a 0.1% of stem cells, but we concentrate that, we divide specifically, particularly, we separate it in our one syringes. And other than that, the plasma thing, other thing, we can divide it. Long time ago, if you think about the PRP thing, as I mentioned in the live show as well, it's hard to take it out with the needle. If you train your nurses or doing by yourself, one shaking thing, it goes all the shaken already, almost like a martini, and then there, you don't know where that stem cell is. As you saw there, like in the live streaming, there's a two lock syringes. It consists of a 3-chamber big one. We can eradicate the red cell first totally, and then you can divide leukocyte area and the buffer coat, which including CD34 stem cell. But the more, as I mentioned before, there are studies when we use the PRPs on the arthritis or the OS in the PS area, some treatment needs require high leukocyte. Some treatment, it turns out to be require less leukocyte. So not just taking all the leukocyte at the same time, whether you want to treat the inflammation, there's in the DASIS cases, you need higher the leukocyte, and then for the arthritis or the tendon regeneration, less leukocyte. So the point is, whatsoever, if you're an OS doctor or just skin doctor, what category you are working on, because we are able to control the leukocyte level on top of dividing completely the red cell and the buffer coat. So that's the allowing very customized procedure to you and your clinic, and ultimately it goes help to the patient, I would say. So that's the thing. The left side is light concentrate. It's not the stem cell, but the light concentrate means like a light leukocyte. Right side heavy concentrated. And I have to deliver this NLR because as I wanted to share the ideas, when I got injection right before I came, I used the 240 cc on my body as well. I wanted more objective about the result of this treatment. So there are many, I work with the top laboratory companies in Korea that I'm going to share with you. So we're using the antioxidant level, CBC level, or the telomere length as well. I'm trying to come up with the more state-of-the-art the test, so to justify or the clarify that actually this helped our patients. So NLR is one of the status, the level, the neutrophil to lymphocyte. So if NLR is high, it means that the patient is under low condition. So after injection thing, if we compare NLR, it could be one of the marker that actually this treatment was helping the patient or not. So as we showed today, we can do the hair loss as well, or we didn't show in the live show, but this is me before I came. And here you can just put in the normal cell line and put it as the IV stem cell right away. You don't need a filter. This is very safe because it's from you directly within about 3 hours. So I'd like to share the cases. we recruited. Recruit means I didn't get any money from the patient. I recruited 11 patients, introducing, explaining what we are going to do. It was simple. I didn't have any disease-based patients, like a general condition people, 11. And from age group to 20, 30, 40, 62 people respectively, and 120 cc. I think that's a standard level of thing. So it's a 4 kits. No known diseases, only IV injection, but those who wanted local injection on the demand. And I did the same running test, including this telomere lengthening 3 weeks after. And then, I'm sorry about this translation available, but that's the raw data that I brought. This is GC Lab, is one of the top laboratory company in Korea. So, which means I would like to say this is authentic result of it. So out of 11 people, so the telomere, as you know, the length is decreases, shortens as we ages. But here after 3 weeks, this is my result. So on top, 5.4 is length of the telomere. On the right side, the 5.5 is the length of the after 3 weeks injection. 40 is the anticipated my body age, and the 37 is after 3 weeks. Well, I asked how do you do the test? They take a white blood cell and then take a telomere from the white blood cell. So for those of you who think telomere lengthening is not possible, then I would say, I asked also laboratory medicine guy in the GC lab as well, within the enabling condition, that it gives you back to the maximum condition, I interpreted this one. So in regard about the comment or the future questionnaires, I'd like to discuss, and then I also want to your country or your based any ideas how to evaluate this functioning thing. I would be more than welcome to share and develop code together. But this 11 people, one was saying 10 all lengthened more or less. And for those took this one, general condition, they all made comment they slept well. Even though they were under a lot of stresses, they slept well, especially in elderly ages. Less fatigue, liver function, which I would usually say when they go to like a bar or they're drinking, they say they do not get wasted compared to what they do after this injection. It was good. And brightened skin texture. And for the local injection, backache decreased, NK cell activation, it only varied. I was expecting NK cell activation all increasing, but somehow was not helping NK activations. Skin atopy, these inflammatory diseases as well, one of, and it got better, but later it got again redeveloped. So I wouldn't say one injection would definitely cure skin atopy. This happened 6 months ago. This we started in the March. So this is like a 6 months after. So this was a very unique thing. I didn't know actually she had a vagina bleeding, and she didn't want to share such an information, obviously. But after I got injection, she was very, very happy and saying that she was so worried. She wanted to go to OBGYN for the checkup, and then it stopped bleeding somehow. And then after that, she really does not have. Why she bled? I asked because she was super higher under stresses. So the vaginal bleeding can happen for those ladies who are under super stress, but it was severe in her condition, she said. And then after 3 days, she was really happy to call me back on her own, even though this might be like some, I would say, very special or intimate information. She called me up. She really wanted to share such a thing. So, and also this result was proven, guaranteed, also statistically as well. Well, these are all the using the Novastem, including the this stem cell thing. So we can use on the this acheness, inflammation, hair loss, liver function, skin wound healing, atopic dermatitis, all of them. Those things are already so much proven if you look up the Google with the SVF fat tissue, bone marrow stem cell, cultivated stem cell media or the stem cell, or even the exosome. These are all the treatment area that we are still using. But I wanted to emphasize, then if you're like a newbie in this stem cell world, can you go now do the liposuction and then do so still? Do you not afraid to break this ASIS bone and right away to take out bone marrow? This will be the easiest way to access to start the stem cell. And one by one, if you gather more information and if you see your patient actually getting better from your treatment, you have more confidence to go more on over than that. I always explain this our Novastem cell compared to like a BMW. I admit that this is not a BMW 7. Like a more cultivation of the BMW 7, SPF from the fat tissue or 7, 5, or the bone marrow, I would say 3. This should be electric 1, I say. But it's not a good vehicle. No, it's not. It is very good entry level, good treatment that you can right away use with your patient. So once again, if I clear this up, cell concentration is really important of this kit thing. The centrifuge machine is also important, and as I mentioned, that 2 locking bar system is what makes differentiation to other maybe stem cell kit or the PRP kit here. So that's mostly about the Novastem or Tricell. So I'd like to have more questions later after the session.